Hi everyone, our group is going to be presenting when occupation changes. So our occupation is going to be motherhood. So Nina is a 32-year-old who's a mother to a 2-year-old toddler. She's currently on her third trimester of pregnancy. She and her husband have prepared their home for the delivery of their second baby. One day she caught an infection that had her bedridden. During her health checkup, she received news that the infection caused some complications. Her baby no longer had a heartbeat and she would need a C-section. Her whole life had been flipped upside down. She now has to grieve the loss of her baby while still being able to fulfill her role as a mother to her 2-year-old and a wife. So Nina, along with other women, have experienced a stillborn are still going to experience a wide variety of biological changes, especially after going through labor. Biological changes can last for multiple weeks to even months, depending on the level of self-care and health management, while still participating in the occupation of motherhood and being wife. She'll be experiencing after pains, bleeding, pelvic floor weakness, and a healing scar. These are normal biological changes that occur after experiencing a C-section. Her breasts will engorge due to lactation, which causes pressure and pain in the breast and nipple area. At the same time, she is experiencing cramping from involution of the uterus, postpartum hemorrhaging, and swelling in her abdomen due to the cesarean stitches. Depending on the individual, this can be extremely debilitating and it increases the risk of infection. So, scar management is going to be extremely useful to avoid worsening symptoms. She may be experiencing a stinging or stabbing pain when sitting, walking, urinating, or defecation. Women like Nina can experience weak pelvic floor muscles that lead to urinary incontinence and overall pain throughout her lower back and during intercourse. Pain can be extremely frustrating and to have, especially when caring for a toddler, affecting the recovery time. Hormonal imbalances are extremely common after labor that will affect sleep quality. Due to her grief, she is going to encounter grief-related insomnia due to her higher level of cortisol. While her body is facing low progesterone levels, which commonly causes depression and anxiety, also known as the baby blues. This will give her issues trying to fall asleep and trying to stay asleep throughout the night. Lastly, she is at a higher risk of stress-induced cardiomyopathy, commonly known as broken heart syndrome. The level of cortisol and grief can be so overwhelming that it can cause physical changes to her heart muscles. The heart will then weaken and change shape. It will become an issue if her grief is chronically elevated, and she may experience chest pain, dizziness, and quick heart rate.
Experiencing a miscarriage comes with many psychological challenges such as grief, guilt, frustration, fear, depression, and relationship strains. When Nina was pregnant, she had dreams and plans of her family of three growing into a family of four. However, due to her miscarriage, she is suffering from a huge emotional blow and is feeling very shocked and deeply saddened about losing her baby. Additionally, Nina is starting to feel guilty because she feels like it's her fault that she lost her baby. She is blaming herself because she feels that if she would have done things differently, she would not have caught that infection that had her bedridden, so she would have not lost her baby. Also, Nina is experiencing frustration not only with herself, but also with healthcare professionals because she believes that they did not do enough to help her. She is starting to notice that she's becoming very frustrated whenever she sees other women in public out with their baby because she remembers that that could have been her. She is frustrated because she feels like she couldn't control what happened to her. Ever since having a miscarriage, she is feeling scared about the thought of being pregnant again. She is worried that she will have complications in the future about pregnancies, and she is scared about not being able to conceive again. This profound loss has led Nina to feeling very depressed because she feels hopeless and unmotivated to engage in anything. She no longer has interest in engaging in any occupations, activities, or ADLs, which not only affect herself, but also her family. She is experiencing difficulty sleeping, losing her appetite, and wanting to isolate herself from everyone. Lastly, going through a miscarriage not only affects Nina, but it also has affected her relationship. Everyone grieves differently, so her way of grieving looks different from her husband's, leading to a misunderstanding. Because they are grieving differently, they are unable to navigate this unfortunate situation together. And ultimately, having a miscarriage comes with a lot of psychological challenges, and these have drastically taken a huge toll on Nina's overall mental well being.
In regards to sociocultural challenges, the four aspects I will briefly touch upon are the cultural, familial, socioeconomic, and educational challenges. We did not give Nina an ethnicity or place of origin, but with our society, childbirth is seen as a rite of passage for women. Giving birth and mothering a child has been socially constructed to be a self actualizing moment as women. Despite her being a mother of a toddler, the mourning of her baby has made her feel less of a mom. Speaking of death is taboo within our culture, let alone speaking of a baby's death. Nina may feel like she has no one to talk to, that no one will understand what she is going through. Within the familial strains, there is always pressure to have more children. Nina and her husband were anticipating the growth of their family. She was finally going to give her toddler a sibling to play with. Socioeconomically, there would be various factors that could strain her ability to grieve her loss. She may need to get back to work. Does she have access to proper nutrition for her recovery? What is her mode of transport to get to and from healthcare facilities, community support groups? Does she have the means for access to healthcare? In regards to education, she may feel as though miscarriage is not common. The World Health Organization states that the miscarriage rate is of 10 to 15% in women who knew that they were pregnant. Addressing this can help her not feel so isolated. Within our society, there's also a lack of gender sensitive healthcare. Our healthcare system is paternal based. With that being said, Nina may also have a hard time identifying support groups and various resources to help her cope with the loss of her child and continue to be a mother, a wife.
How can our role as an OT help Nina in this phase of her life? Nina is going through a very pivotal time in her life full of grief, transition, and a whirlwind of emotions. But with this being said, Nina is not able to just simply put her life on pause as she wants to continue showing up in her role as a wife and a mother to her 2-year-old son. With a holistic approach, occupational therapy can help Nina grieve, process, and engage in her day-to-day to ensure she continues living a meaningful life. As a mother grieving the loss of a child, it can be difficult expressing an emotion you know others may not be able to understand. With advising her to journal, it can be a great way for Nina to get her thoughts out and not feel as overwhelmed. Stress and anxiety can also be affecting Nina's daily life. So thinking of the what ifs, trying to pinpoint what went wrong, etc. With deep breathing techniques, occupational therapists can help Nina trigger a parasympathetic response, and this can help remind her that she is safe and help her calm down. Parenting support is also going to be something Nina can benefit tremendously from, as she does have a 2-year-old son. Patient education on being present, mindful, and overall having gratitude for what she does have can allow Nina to have a different perspective on the current phase of her life. Motivational interviewing can also be something Nina benefits from. This is a great way for Nina to have a positive self-talk and can lead her to positive changes. For example, I am strong, I am a good mother, I am capable, and I will get through this, therefore I will. Household adjustments are also another area where OT can intervene. Creating a realistic schedule to maintain her home, as well as meal prepping and planning out her days, can help Nina participate in what she loves to do without having to sacrifice anything due to her being overwhelmed. Resources are also very important during a time like this, such as grievance counseling, support groups, and even marriage counseling. A support group can surround Nina with like-minded mothers attempting to uplift one another and transition together. Creating a safe space for Nina to express and communicate her emotions is the top priority. Although above I did say that being present can help Nina have gratitude for what she does have in front of her, this does not mean she should forget about what she has gone through. She can honor her baby, as this can help her process what has happened and find closure in it as well. Like I mentioned before, Nina is a mom of a 2-year-old boy, and she is constantly trying to be up on her feet, tending to her son. Engaging in physical activity through meaningful occupation is going to be essential to keeping Nina's health and present with her parenting, as well as pelvic floor therapy to focus on strengthening her pelvic floor muscles so that she is able to participate in these occupations without embarrassment or anticipation of unwanted bathroom visits. Overall, taking it day by day and finding out what matters most to Nina can allow a collaborative patient-clinician relationship to deliver patient-centered care.